Hello, good day everyone. NurseFelly is back on page. Please remember to like, comment and share. Today I will be discussing with us dysmenorrhea. This is a very common disorder of menstruation, also known as painful menstruation. Some people do experience this, and we have two different types. One of the type of dysmenorrhea is commonly known as the primary, and the other one is the secondary. Which one is the primary, if I may ask? The primary is the one that right from the onset, when the person starts menstruating, the person experiences pain. Pain can occur two days before the menstruation, and while the menses is still ongoing, while the person still feel pain. Then the secondary dysmenorrhea is the one that occur later on in life. Maybe when the person is not 30 or 30 something, the person experience painful menstruation. This one is associated with some disorders. The primary dysmenorrhea can be easily managed, especially if the person knows when the next menses will start. It is advisable that the person takes some rest, avoid cold drinks, then also apply some heat pad on the lower abdomen. This will help relieve the pain or the discomfort. Somebody might be asking, where is this pain coming from? The pain is coming from the uterine wall, the womb. You know, people will say womb, but we call it the uterus. When there is contraction of the muscle around that area, the person begins to experience some cramping pains. And this pain can be mild, it can also be severe. When the pain is very severe, when the person is experiencing very strong pain, it is advisable that the person takes medication. It can be tablets, it can be injectable form of medication. But if this pain is mild, by taking some rest, applying some heat, as I've earlier mentioned, to the lower abdomen, this will help to relieve the pain. Then remember I mentioned the secondary type of dysmenorrhea. This one is common among women from 30 and above. This one occurs as a result of an underlying disease condition. Which are these? Example of such disease condition is, let's say for example, a woman that has fibroid can experience secondary dysmenorrhea, in the sense that from the onset of menstruation, she is not experiencing pain while menstruating. But later on in life, she begins to experience pain. It can be a sign of fibroid. Sometimes this fibroid can be little, and we know that it can increase in size as time goes on. The other thing that can lead to secondary dysmenorrhea is what we call cervical stenosis. What is cervical stenosis? Is that when people will say, by the time you give birth one or twice, you will not experience pain again, because then your cervix has a little bit open. What do they mean? The cervix is very tight. That's a cervical area. So when the menses is trying to flow out, there is increased pressure, and that pressure is what the person experiences as pain. Another underlying thing that can cause secondary dysmenorrhea is what they call endometriosis. This one is big grammar. What is endometriosis? Is a type of a disease condition whereby some muscles will grow outside the womb or outside the uterus. It can grow around the fallopian tube. It can grow around the ovaries. It can even grow around outside the entire uterus. So when this kind of thing happens, those muscles will also be contracting when this person is menstruating, and this person will be feeling pain. Sometimes it can be an excruciating pain that the person cannot just, it can't be relieved with just a heat or stress. This pain is there, and some level of endometriosis can lead to infertility. You find out that this person is difficult for this person to be pregnant, and this person will be wondering, yet I'm ovulating, I'm menstruating, and pregnancy is not forthcoming. It is advisable that this person meets a gynecologist who will examine this person and explain better to you what you are passing through. Some people are already familiar with the fibroid, but this endometriosis is another common type of pain that lead to painful menstruation. In summary, the management of dysmenorrhea or painful menstruation is taking a good rest, applying some heat pad on the lower abdomen where you feel the cramping pain. Sometimes some persons can even feel back pain around their waist region. They can apply heat pad around that area. If that is not relieving, they can take any pain medication to relieve this. They should also bear in mind not to take some of these non-steroidal anti-inflammatory drugs if there is a history of ulcer. Then for this endometriosis, if there is an underlying disease condition, it is advisable that they follow up with their gynecologist or their physician who will help to manage this condition. Please, if you like this video, please remember to share and to comment. And if you have any other video in mind that you want me to digest more about, please put on the comment section. See you. Bye.